Good day, everyone. I am Kyle Russell Paredes, and I am honored to present my report on a significant organization called Likhaan Center for Women's Health. This organization serves as a compelling example of how advocacy, communication, and social mobilization can be strategically used to advance reproductive health and human rights in the Philippines. Through this presentation, we will walk through their history, core programs, strategic approaches, and most importantly, their impact on the lives of marginalized communities. The Philippines continues to face significant challenges in ensuring universal access to sexual and reproductive health services, particularly for women and impoverished communities. Gender-based violence, unintended pregnancies, maternal deaths, and lack of access to contraceptions are prevalent, especially in underserved areas. In response to these issues, the Likhaan Center for Women's Health was established in 1995 to promote health equity and justice. Likhaan is a non-government organization with a clear and powerful mission to achieve health and equality, particularly for women and disadvantaged communities, through the lens of human rights and social justice. The organization believes that access to healthcare should not be a privilege, but a right that all individuals, regardless of their socioeconomic status, can enjoy. By focusing on underserved populations, Likhaan bridges gaps in services and challenges the systems that perpetuate inequality. Likhaan was founded in 1995 by a group of women activists, health professionals, and community leaders to develop alternative pathways for women toward the achievement of the highest possible state of health and rights. It was established to address the key issues of inadequate access to key SRH care services by women, especially poor and marginalized women. Likhaan addresses three key and interrelated SRH problems: the very low decline in maternal mortality, high rate of unintended pregnancy due to low contraceptive access, and significant prevalence of sexually transmitted infections, including HIV and HPV. It started with two small community-based women's health programs located in poor urban areas. These programs were coordinated by local women leaders who were trained and supported by a core team of health professionals and advocates. This grassroots approach laid the foundation for its community-centered model. They were fortunate to receive funding support for community education and organizing from activist organizations in Canada and Scotland, and for developing sexual and reproductive health services in women's clinic from the UNFPA. Today, Likhaan operates 9 community-based health programs for CBHPs across multiple locations: 5 urban communities in Metro Manila, 2 semi-urban provinces, and in rural provinces. So this expansion reflects their long-term commitment to sustainability and service to marginalized populations. The overarching goal of Likhaan is to reduce deaths and illnesses related to sexual and reproductive health, especially among the poor. They seek to increase access to SRHR information and services. And this includes strategies like delivering direct healthcare services through community clinics, organizing communities to demand accountability and services, and engaging in policy advocacy to push for systemic reforms. So Likhaan delivers direct health services through a network of community-based clinics and mobile health units. These facilities provides a wide range of services, including family planning, maternal care, safe birthing, treatment of sexually transmitted infections, and post-abortion cares. Additionally, Likhaan's programs address gender-based violence and offer counseling, legal referrals, and psychosocial support. The organization also trains community health workers to deliver peer education and basic health services, increasing local capacity to respond to health needs. So, in essence, they do not just deliver services, they enable the people to claim their rights and participate in shaping public health policy. Advocacy plays a central role in Likhaan's work. The organization actively participates in pushing for progressive reproductive health policies and ensuring that marginalized voices are heard. Some of their key advocacy initiatives include leading roles in coalitions like the Reproductive Health Advocacy Network, producing evidence-based policy recommendations and reports, organizing public awareness campaigns and electoral initiatives to support pro-reproductive health candidates, participating in legislative consultations to shape national health agendas, and conducting trainees for grassroots communities to empower them to demand services and accountability. So their advocacy extends beyond policy change. It's about transforming social norms and empowering the community. So Likhaan employs a dynamic and inclusive communication strategy to reach poor and marginalized sectors. They develop and disseminate information, education, and communication materials, or the IEC materials, specifically tailored for their target audiences. And this includes illustrated pamphlets and posters written in local languages, street plays, puppet shows that make complex issues accessible, and peer education and storytelling sessions for young people and women. So they also conduct training and community forums involving adolescents, especially on issues like teenage pregnancy and consent. Community health workers who serve as local educators and partner organizations that amplify their reach. Furthermore, Likhaan maintains a digital presence via social media and their website to educate the broader public and advocate for national attention to women's health issues. So, social mobilization is about creating active, empowered communities. And Likhaan organizes groups like PILAK, or Pinagsamang Lakas ng Kababaihan at Kabataan, which includes their tactics of organizing community-based women's health associations, supporting capacity building activities such as health leadership training, holding forums, mobilizations, and protests to demand public services and policies, and facilitating participation in policy dialogues at local and national levels. So this bottom-up approach ensures that solutions are locally generated and driven by the very people who are most affected. So Likhaan's impact is substantial. In 2023 alone, it recorded over 49,000 consultations and provided more than 42,000 family planning services. Its community organizing efforts have led to increased political participation among women and greater accountability from local governments. Likhaan's presence in policy advocacy has helped shape national discourse on reproductive rights. Programs like the 2022 elections campaign empowered women to make informed choices and advocate for their health and rights. So Likhaan's achievements span community, legislative, and policy levels. For instance, their advocacy was instrumental in the passage of the Responsible Parenthood and Reproductive Health Act of 2012. One thing is, thousands of women have received free or low-cost SRH services. They also trained hundreds of community health workers and advocates, and they increased visibility of reproductive health issues through mainstream and alternative media. So, what makes their impact sustainable is their ability to link their service provision with policy change and community empowerment. So, Likhaan is a model ACSM program because it combines three interconnected strategies. One is advocacy. They partner with institutions such as the Department of Health and the Department of Education to shape reproductive health policies. Communication, their materials and messaging are grounded in local culture, making them effective tools for behavior change. And lastly, social mobilization because they build networks of empowered individuals who work collectively for health equity and rights. So this integrated approach ensures that change happens not only on paper but also on the ground. So to conclude, Likhaan demonstrate how a holistic ACSM framework can address deeply rooted health inequities. Their model goes beyond service delivery. It inspires grassroots leadership, informs public discourse, and institutionalizes policy changes. So Likhaan reminds us that real change comes from empowering communities, valuing lived experiences, and advocating for systemic transformation. They offer a roadmap for how organizations can operate effectively at the intersection of advocacy, communication, and social mobilization. So thank you for your attention. If you have any questions or wish to explore more about this topic, I'd be happy to engage further. So you may reach out to me at my email. Again, I am Kyle Russell Paredes, and I hope this presentation encourage us to support inclusive and rights-based health programs like Likhaan.